Good morning, everyone, and thank you for joining us. You should see a poll pop up on your screen, so if you could participate in the poll with us, and we'll get started here in just a couple minutes. Good morning, everyone. I see folks joining and the number ticking up here. There's a poll on your screen. We'll get started in a couple minutes, but if you could participate in that poll, that would be great. Thanks so much. All right, good morning, everyone, and thank you for joining us. If you haven't completed the poll on your screen, please do so. We're going to go ahead and get started. We have a full agenda for you here today. I'm Lillian Gutierrez, and I'm the Assistant Director and Legal Counsel at Groundwork Ohio. And Groundwork Ohio is the state early childhood advocacy organization whose mission is to champion high-quality early learning and healthy development strategies from the prenatal period to age 5. A few housekeeping reminders for us. You are on mute. I cannot see you, unfortunately, but I hope you can see me and the other panelists and our slide presentation here today. If you have questions or concerns or just want to give a shout out, let us know you're here. Please utilize the chat box for those functions. This webinar will be recorded and shared. So you will receive an email with that, and it will also be available on our website. If you have a specific question and you'd like to put it in the chat box, please also provide your email address so we can follow up with you if we're not able to answer it during the event. We are also sharing a social media toolkit in the chat box now. So if you want to show your support during and after this event, you're inspired by something you hear or want to share Ready, Set, Soar Ohio with your networks, we've made it easy for you with sample posts and images. So again, that link will appear in the chat box. So again, welcome. Ready, Set, Soar Ohio is a diverse statewide coalition of early childhood education, health, advocacy, philanthropy, and business organizations, community leaders, policymakers, and families. This coalition is committed to ensuring that more pregnant women, infants, toddlers, and their families have access to the support they need to be ready, set, and soar to their full potential. Our work began together with a 6-month planning process during the first 6 months of 2019, when we brought a focused and diverse set of experts from across the state to build an agenda to respond to the urgent needs of pregnant women, infants, and toddlers. As we've been implementing this work, we thought it was more important than ever today to renew the promise we made to Ohio families and communities. Here is a short video introduction of Ready, Set, Soar Ohio.
100 organizations from all across Ohio have come together to ensure our children and our state have a great future. They're supporting Ready, Set, Soar Ohio because they want all pregnant women, infants, and toddlers to be healthy and thrive. Too many women are not getting critical prenatal care. Too many infants die before their first birthday. Too many children are not receiving early interventions that set them up for success. COVID-19 has made all these problems even worse. Supporting children early saves money. It's an investment. It's the right thing to do. Will you help ensure all children are ready to thrive? All families are set up for success. All children can soar to kindergarten and beyond. Together, we can make Ohio the best place to be a young child.
Here is just a snapshot of our incredible coalition of organizations and individuals across the state of Ohio who shared our vision to make Ohio the best place to be a young child and have dedicated their time, talent, and voice to get there. We have set bold goals to fulfill our vision and mission, which is to serve 50,000 more pregnant women, infants, and toddlers in high-quality early interventions by 2023. And it is in moments like these today, amid a global pandemic and the fight to dismantle systemic racism that far too often undermines the outcomes of our youngest children long before they are born, when our babies and our families are struggling the most, that we are reminded that we must be bold. Our children need us now more than ever. Here is the Ohio story.
A child's first 1,000 days. That's when 80% of brain development occurs, setting the foundation for later learning. If they don't have enriching experiences, if they don't get quality health care, critical areas of their brain don't develop properly. All babies and toddlers need access to preventative health care, high-quality early learning, and stable and empowered families. Too many Ohio children don't get the early support they need. Children experiencing poverty. Our Black and Appalachian children are especially struggling. Ohio has over 500,000 children under age 3. Half live in poverty. And yet only 1 out of every 25 children who could benefit from Help Me Grow home visiting services are able to access them. And only 1 in 4 eligible children are able to access publicly funded childcare. And we wonder why only 1 in 4 children experiencing poverty start kindergarten on track. Catching children up is hard. What if we were smart and invested early, before gaps emerge?
Ready, Set, Soar Ohio is committed to closing gaps where they begin, because we know that if we don't invest early during this critical period of time, low-income children are up to 2 years behind their higher-income peers when they enter kindergarten. And despite our best efforts in child-serving systems later in life, regardless of the measure, be it health or education, these gaps rarely close. More concerning is that in this moment, we can predict who's more likely to get left behind, whether it be determined by race, poverty, or geography. Let's take a closer look at early childhood equity through this next video.
Ohio needs all children to succeed. It's not fair to say that only some children deserve a chance to grow up healthy, get a great education, and go on to have a rewarding life. Some Ohio children are more likely than others to lack opportunity. Race, socioeconomic status, geography, gender, physical ability, and intellectual ability all impact a child's opportunity for success. 1 in 2 Black babies, 1 in 3 Appalachian babies are born into families experiencing poverty through no fault of their own. They'll likely struggle from the start. Studies show low-income children, on average, start school 2 years behind. That gap almost always continues through school, even growing for Black children. If we don't support these children and their families when it matters the most, our children will pay the price. But so will we.
One of Ready, Set, Soar Ohio's founding principles is equity. We've disaggregated data, exposed what it means to be a young Black child, a young Appalachian child in Ohio, and are committed to advancing equitable outcomes for these young children in our state. That means giving each child what they need to be positioned for success and challenging the systems, policies, programs, and individuals that are designed to serve them. So let's talk about the impact of COVID-19. Since the pandemic began, we have asked ourselves so many questions. How the experience of pregnant women has changed, whether parents are getting the support they need, where babies are being born and cared for, how child maltreatment rates are changing, whether or not our babies are getting preventative health care and immunizations, how families of infants and toddlers are often choosing between going to work and caring for their child without access to quality childcare. We have sought answers and data from across the country and grappled with our findings with our closest partners and advocates across the country. As a result, we've ensured that Ready, Set, Soar's policy agenda is responsive to the increased and changing needs of pregnant women, infants, and toddlers. But there's no denying that even prior to the pandemic, we were experiencing a confluence of crises: the maternal mortality crisis, infant mortality crisis, childcare crisis, workforce crisis. I share that to say that this coalition, this work was built for a moment like this. Our measures of success may look different, but our objectives are unchanged. What has changed is the absolute urgency with which we must approach this work. We now have over 500,000 infants and toddlers experiencing now 7 months of their precious 1,000 days of their life, where 80% of their brain growth is happening, in a global pandemic, where their adult caregivers, for whom they rely on for everything, including quality interpersonal interactions that quite literally build the architecture of their brain, are experiencing an acute crisis. So we will be smart, we will be strategic, and we will be nimble to a shifting landscape. But we are also going to be relentless. We're going to be asking more of our policymakers and our early childhood systems than ever to bring priority to our youngest children. As we respond to the immediate crises at hand and do the next right thing for children, make no mistake that the lost ground, the tragedy, and the panic of this time will not be in vain. We will resist the urge to try to recover back to the way things were before and continue to reimagine and act upon a path forward that fulfills our mission and vision for young children in Ohio. So what will it take? We need children ready to thrive. We know that infants and toddlers who are born healthy and develop in healthy environments and have access to quality healthcare services have better physical, emotional, and mental health throughout their lives. This includes increasing access to timely and comprehensive quality prenatal care and extending postpartum coverage for pregnant women and mothers covered by Medicaid, ensuring and expanding coverage and access to health care through Medicaid and CHIP for infants, toddlers, and their families, supporting early identification, diagnosis, and treatment for infants and toddlers to meet their mental health and developmental needs, supporting access to these same families for nutrition support programs, and protecting babies from lead hazards where they live and learn. We need families set up for success. Families are the first and most important teachers, playing a critical role in a child's development in the first 3 years of life. When families have the resources and support to provide adequate care and enrichment during the earliest years, children can grow and thrive. In order to have families that are set up for success, we have to empower parents of infants and toddlers by increasing access to evidence-based home visiting services. We have to reduce the incidence and impact of trauma among our youngest children and increase access to programs that build resilience and mitigate its impact. We need to stabilize families and keep babies out of state custody. We have to foster economic stability for families, and we need to expand broadband access to connect families with infants and toddlers to the supports and services that they need. And lastly, we need children soaring to kindergarten and beyond. Babies are born learning. High-quality childcare gives children the opportunity for social, emotional, and intellectual development to be ready for school. If ready for kindergarten, children are positioned for success in school and life. So to get there, we are asking in our policy agenda to expand access to quality publicly funded childcare for infants and toddlers by increasing eligibility to 200% of the federal poverty level. We know that more families need access to care. We need to ensure that infants and toddlers have access to high quality learning environments where programs meet their unique needs. We need to expand access to high quality preschool and Head Start and support a quality early education workforce that's highly qualified, well compensated, and prepared to support the development of infants and toddlers. The policies and investments are foundational to ensuring Ohio is the best place to be a young child. And now we'll share with you this last video.
It's not rocket science. When we invest early in young children, we save later. More children are kindergarten ready. They're less likely to be held back. They're more likely to graduate from high school. They're healthier, and they go on to earn more as adults. Putting our money in prenatal to 3 early interventions has a 13% return on public investment per year. It's time to get smart. For Ohio's children, families, and taxpayers, we must invest when it matters most. Together, we can make Ohio the best place to be a young child.
I know you can't see me and we can't see each other, but I hope you feel the energy of this morning and of this event as much as I am. I'm inspired by all of you who are here today. And I just have to say this again, and I think we've said this before, but we know the brain science of early childhood. We know the economics. We have a countdown to what success looks like, including the policies and investments in pregnant women, infants, and toddlers and their families that will make Ohio the best place to be a young child. We have a diverse and committed coalition of engaged organizations and leaders ready to act, and we are not alone. Our friends, neighbors, communities, and voters across the state are with us. A snapshot of polling recently conducted by Groundwork Ohio finds that 7 in 10 Ohioans recognize the most important years for developing a child's capacity to learn occur before age 5. What's more is that 60% of Ohioans agree that more should be done to ensure children begin kindergarten with the skills needed to do their best. And yet in fiscal year 2019, state investments in young children only account for about 6% of Ohio's total annual state budget. We know a budget is a statement of priority, and so today we're asking you to join us and help us answer and act upon the question of what will it take to make Ohio the best place to be a young child? What will it take to prioritize our most at-risk pregnant women, infants, and toddlers? So, I'm not going to answer this alone, and we have and are grateful to be joined today by an esteemed panel to help us answer the question by sharing their work, their commitment, and their experience with young children in their communities and the state. So we are happy to welcome Director Leanne Cornion. She is the Director of Governor DeWine's Office of Children's Initiatives. Rosalind Grant, the Director of Curriculum and Instruction at the Centers in Cleveland, Ohio, and County Commissioner Carolyn Rice from Montgomery County. Thank you so much for all you do for Ohio kids. We have prepared a few rounds of questions for you today, and I'm going to ask the question and then direct the question to one panelist at a time. So let's get into it. The first question that I'd like all the panelists to share with us today is who you are, why and how you are engaged in work that's responding to the needs of pregnant women, infants, and toddlers, and why is this work more important now than ever? And I'm going to start with you, Commissioner Rice.
Well, Lynn, it is such a pleasure to represent the entire Montgomery County Commission on this panel today. I'm so excited. As many of you know, for more than a decade, Montgomery County has strategically focused on increasing our investment in young children. And among our highest profile projects is the Dayton Montgomery County Preschool Promise, which is working to promise that every 4-year-old in our community has access to at least 1 year of affordable, high quality preschool. But as you've already shown, quality early learning experiences aren't all that young children need. We have to do right by them starting at birth. And as a former teacher of children with special needs, I know how much early help can do for a child's success, first in school and then later throughout their adulthood. That's why I'm so proud to help lead Montgomery County's Birth to 3 collaborative. This group is focused on improving services for our youngest children when it matters most. And as you said, in those 1,000 days when babies' brains are developing fastest. Our local organizations that support new mothers, young children and families, we meet monthly to identify how we can better leverage all of our efforts. We're targeting our highest need families, and particularly Black families who lack equitable access to opportunities and resources. And I'm just going to give you a few examples of what we're doing. We're working to expand evidence-based home visiting and promoting early identification of health and wellness. And my fellow commissioner, Debbie Lieberman, has focused on infant mortality for a number of years. We're also promoting the ABCs of safe sleep. Babies should sleep alone on their back and in a crib to prevent needless deaths caused by parents and adults not knowing these safe sleeping basics. And it really breaks my heart whenever I learn of this in our county or anywhere. Over 35 community partners are supporting our On Purpose Play initiative. And the goal of this program is to, we hope to blanket Montgomery County with playful learning experiences that drive home the idea that children learn beginning at birth. We've helped bring Lena, a technology that documents and encourages communication between parent and child to increase the child's language development to our community. And last December, we were the first Metro County to sign on to the Dolly Parton Imagination Library Initiative that Governor and First Lady DeWine have been championing. We registered, now get a load of this, we registered nearly 1,000 children in the first 24 hours after we launched that program. And we are now up to 8,000 children, 0 to 5, who are enrolled in the program and receiving free books on a monthly basis. And we still know that we have to work very, very hard to reach children in zip codes of our neediest families. And I am also excited, last month, our Montgomery County Juvenile Court received grant approval to create an infant toddler court, sometimes known as safe baby courts, that will be a special docket to focus on babies and toddlers and their families to wrap the entire family in services that are needed. And we've seen this holistic approach has proven quite successful in other states and counties. So we are tremendously excited that this will bring real help for our families and children to get on the right track. So I can't wait to see how this all turns out. And as you can see from all the things that, efforts that I've listed, we in Montgomery County, and certainly myself, are fully engaged in doing all we can to give our youngest citizens the start they need to bloom and grow so they become healthy, strong, and as successful as they can be.
Thank you so much, Commissioner, and we're so excited to have you and your leadership as a local policymaker and your enthusiasm. If you didn't feel it with me, you have to feel it with Commissioner Rice, who I feel that whenever we've been working with you over this time, when it comes to infants and toddlers, you're making it happen within hours or days to start making the connection to that next right thing in your community. So thank you so much. Rosalind, can you please share with us who you are, how you're engaged in this work, and why this is more important now than ever?
Absolutely. Good morning, everyone. My name is Rosalind Grant. I'm the Director of Curriculum and Instruction at the Centers for Families and Children. So we serve, we have our Smart Start home visiting program, but we also have a center-based program. We have 7 early learning centers across the Cleveland area, all 5-star rated centers. And so I'm just so excited to be with you guys today. To answer your question, we kind of heard in the video, and we know that research tells us that between conception and the age of 3, a child's brain undergoes an impressive amount of change, right? Even at birth, it already has about all of the neurons that it'll have. And then by the first year of life, that doubles in size. So when we get to the age 3, we know that it's already reached 80% of its adult value. So what does that mean, Rosalind? What does that mean for children in Cuyahoga County, children in Ohio, and children across this world? We have a short time frame to do so much. The physical body is moving. That brain is developing. It's going to be prepared, but the experiences, that quality child care, specifically with the center's quality home visiting care, that is going to help shape the direction and the destination that children go as they move on to other parts of their, other phases and parts of life. And so I'm just, again, excited to be here and excited to share a little bit more in the upcoming questions about the services and supports that we offer at the Centers for Families and Children. Thank you.
Thanks so much, Rosalind. And I'm sorry, all, if you can't see me, the good news is I can still hear you, and I'll figure that out. Let's move on to Director Cornian. Thank you so much for being here, and please share with us your work and why this work is more important now than ever.
Good morning, everyone. First and foremost, I'd like to thank everyone who's on the call, who's a parent, an educator, an early childhood professional. You all are doing unbelievable, amazing work, and we are so grateful for everything that you all do day in and day out, boots on the ground. So thank you for being here this morning. I'm Leanne Cornian. I'm the Director of Children's Initiatives for Governor Mike DeWine. This is a brand new role that the governor created shortly after being sworn into office in January of 2019. And my role is really to work across our child-serving cabinet agencies to align programs and advance children's issues, to really make a seamless safety net of programs for our families that are easy to access and high quality. We really are keying into a handful of policy priorities that includes increasing the number of families that are served by evidence-based home visiting, improving the quality of childcare and expanding access, increasing access to school and childcare-based physical and mental health services, promoting resiliency through prevention programming, and reforming our foster care system. We know that if we get all of those pieces and parts right, we're going to give our kids the best possible shot at a healthy and bright future. So a little bit about my why. Much like Commissioner Rice, I'm a former teacher. I was a science teacher at a very high poverty middle school in central Los Angeles. And at the time, I didn't quite understand it, but what I saw amongst many of my students were the implications of trauma, toxic stress, and a lack of quality early childhood experiences that impacted their ability to learn and succeed. Unfortunately, at no point in any of my pre-service training or ongoing professional development did I ever learn about any of those things: toxic stress, adverse childhood experiences. So my kids may have made tremendous academic growth, but there's many things that I wish I could have changed about my teaching practice to improve their entire development and outcomes. So knowing what I know now, really my goal in this role is to not only help provide pregnant women, families, and children with the supportive services that they need to be healthy and resilient for a lifetime, but also to help our caregivers understand these important lessons and how to incorporate trauma-informed practices into their professions. So certainly, as the videos have explained, COVID has compounded many of the stresses that our families are experiencing, which can impact the brain development, and potentially the lifelong success of our kids. So certainly all of these interventions have never been more important, but I also want to highlight something else that's currently ongoing, and that's the federal census. So hopefully everyone who's on this call today has completed their household census form. It's so important. But we anticipate, if trends continue the way that they have, what we're likely going to see is that Ohio is an aging state, that our growth is stagnating. So really that highlights the absolute importance of every single child living up to their full potential, to ensure that we have a bright economic future for our state, that Ohio continues to be a great place, not only to be a child, but to be an adult and to start a family and to own a business. So I appreciate Groundwork and Shannon and Lynn-Ann creating this event today for us to talk more about all of this important work. Thank you.
I'm sorry about that. I was saying thank you so much, Director Cornian. I never get tired of hearing from you and from the governor our shared commitments to our youngest children. So thank you so much. And I think that many of the folks that are on the call and even the panel today just need to know that Director Cornian is at the epicenter of the problem solving around the pandemic. And we're just so grateful for your leadership, and really it's just so good to see you today and have you here with us. So thank you so much. So next, we're going to move on to our next question for the panelists. And again, I'm going to ask that these panelists answer the same question again. And that is that in consideration of the current movement for racial justice and what we know and continue to learn about the disparate impacts of our existing child-serving systems in the wake of COVID-19, how are you acting to advance equitable outcomes for pregnant women, infants, and toddlers? And I'm going to start with Director Cornian this time.
So I'll just say that I authentically believe that the very core of our children's agenda that Governor DeWine and Lieutenant Governor Husted have charted is rooted in equity. It's rooted in improving outcomes for our most vulnerable and marginalized kids and families. However, we have to have a relentless focus on equity as we continue our implementation of the kids' agenda. So we're doing that by better tracking data and using data-driven decision-making and how we target not only our financial resources, but also our programmatic resources in targeting the right places and in our highest need communities. Additionally, many of you all have seen during the governor's 2 o'clock press conferences that he's given a very clear directive to his cabinet directors to tackle systemic discrimination head on. He's tasked them with evaluating their policies, their practices, to identify areas that are contributing to racial disparities. I'm proud to work with the Department of Job and Family Services regularly, and they're really taking a lead on this by engaging former foster youth and families in a person-centered design to evaluate why we have disparate outcomes for African American and minority children in the foster care system. And that's more of the great work that we need to keep doing. But I think that's really been one of Children's Initiative's best strategies in maintaining an equity focus in our work. And that's by engaging the families that are served by the programs that we work on. We're going to continue doing that, obviously, but we're also excited about the newly formed Equity Advisory Committee, which will be stood up very shortly. And their goal is really to work across state agencies to help us maintain an equity lens in everything that we do. So certainly we're going to be partnering with them from day one to prioritize equity and strive to continue to reduce disparities in all of our programs. Thank you.
Director Cornian, we really are looking forward to supporting you and that work. Next, I'm going to ask the same question of Rosalind.
Thank you. So I was just trying to get refreshed on where we are in the county of Cuyahoga and in the state of Ohio. And I just want to remind you, when you asked that question, in 2018, we saw that 15.49 deaths per 1,000 lives were lost, right, for infant mortality. And then in 2019, a little under 14 deaths per 1,000. So we saw a little bit of a decrease, but one thing we want to focus on is that for Black babies, they're still dying at 3.5 times the rate than Caucasian children, right? And so what does that tell us? That we have a problem. We have to fix the societal and environmental factors that are causing and contributing to this disparity. So at the Centers for Families and Children, especially in the wake of COVID, we've seen where families are suffering, right? They're suffering from loss of jobs, loss of incomes, being isolated. And I'll talk in our next question about what our home visiting and our center-based programs are doing to make sure that we stay connected. And there's a lot that goes with being connected. But we realize that, we know that the brain is pattern seeking. And just like children thrive and need consistency and routine, so do families. And so if I could just kind of walk you through, once a family enters our home visiting program, they are set with a home visiting teacher, a professional development specialist, and in our Smart Start program, and they are given an ACE assessment. So the ACE is the adverse childhood experience. And I'm sure many of you have heard of that, and you know that when a family takes an ACE score, sometimes they don't even realize they've experienced trauma because it's a way of life for them. So they're just living in that cycle. But that assessment brings that to light. And we know that research has told us that depending on the ACE score, that will have a direct effect on one's mental or physical health. And so that's a really good starting place for our families. So that allows us to then wrap them in our 2-gen approach. That allows us to set goals with them, attainable goals with them. That allows us to, at the centers, I like to call us like, we're like a one-stop shop. We're like going to Walmart, where you can get food, you can get clothing, cleaning supplies, and so forth, right? You come to the centers, and we have this saying in our program where we often say, every client, every door. And so when you come into our early childhood setting, if you are in need or looking to advance in the workforce field, we will connect you with our workforce development program. If you are suffering from some traumatic events and you need behavioral health services, we will connect you to that program. And so there's so many different avenues that we have right under our umbrella that helps us to really wrap our families in support and as well as in love. And so I think that especially in the wake of COVID and what we're seeing now and when we talk about the race relations here, I think it's important that we highlight especially our Black families and our Black babies, and make sure that we make those supports and those services available to them. And we are doing just that.
Thank you so much, Rosalyn. And Commissioner Rice, how are you acting to advance equitable outcomes for pregnant women and young children?
Well, in Montgomery County, we have explored and adopted a variety of services to tackle the inequality that exists, and this is really even before the pandemic. And whether these services are new programs that we've developed or they're solutions that have worked other places, but we've adapted them to meet our needs, the focus here is always on meeting the specific needs of our community and the challenges our citizens face. So we have been analyzing data to track access to health and educational services and all those important factors. And it's broken down by zip code and race and ethnicity and income levels. And the importance of this, and I think Leanne already mentioned this, is that it helps us to understand where we have service gaps and develop strategies to eliminate the gaps. And so I'll just take one example. 5 years ago, we began an effort to address the disparity in birth outcomes. I think, Rosalyn, you were just talking about this. Our data showed that it was 4 times riskier for a non-white mother to have a child than a white mother. And so looking at solutions across the country, we developed a community health worker program to contact pregnant and new mothers and help them through both their pregnancy and their first year of parenthood. We also have a centering program that creates cohorts of mothers to support each other and their children during this important period. And as a result of these efforts, we actually saw infant deaths drop by 30% from 2017 to 2018. So we believe this approach is heading us in the right direction on this issue. And I think in my opening, I said that Montgomery County has dedicated public dollars to improving childcare for more than a decade. And our efforts to increase the number of infants and toddlers in high quality childcare, we are prioritizing childcare providers that are owned and led by African Americans. And we are making sure we provide culturally responsive training for our teachers and our directors and our owners. So I believe we've always worked on tackling the disparities in our community, but since the pandemic hit, and I know this has been said already more than once, we have discovered in a powerful way that these issues aren't just a concern for parents and educators and government, but business leaders are also seeing the importance of it. And the bottom line is that we must all work together. And the issues are very vivid now. No one can say they don't see them. And there's so many of them. And you've highlighted a lot of them. But we all, if you've even been working on it before, we need to step it up to address these inequities, because in the long run, it will not only strengthen these children and their families, but the truth is it's going to strengthen our entire communities and our entire state, and quite honestly, our nation, if we really zero in on these and challenge ourselves not to be happy with a little bit of progress, but stay at it for years and years to come. And I'm totally dedicated to that process.
Thank you so much, Commissioner Rice. And I know all of you have been engaged in Groundwork Ohio's equity-focused work that really led us to be here, focusing on the first 3 years of life. We have to be very deliberate about where gaps begin, even before a baby is ever a twinkle in a mom's eye. Our moms, our parents, our families are living in our communities. And we really look forward to centering those families, especially Black families, in our work. So thank you. So now I'm going to address some individual questions. We have such incredible experience and different points of view here on our panel. So I'm going to start with Rosalind. And specific to something that's really important to our agenda, and you've heard from Director Cornian, it's part of Governor DeWine's agenda that he's been leading on, is home visiting. So can you share with us what you're seeing and learning about the impact of evidence-based home visiting from providers and families?
Sure. So I want to just kind of take you through, I kind of started to talk about this in the last question, but what it would be like for families entering our home visiting program. I talked to you about, especially for our families of color, for all families, but in particular looking at the ACE study. But it's a little more to it than that. When our families enter the program, they are given a family assessment, which helps their home visiting teacher to really identify the family needs. And then from that, they are setting attainable family goals. They are referring them to needed resources and supports within our program, but also with our community partnerships. They are making sure that even now, during these times in the midst of this pandemic, that they are connecting with families through weekly virtual home visits that they're doing virtually with the family, and then 2 socialization, group socialization visits per month. One of the things that's really interesting and exciting about the work that they're doing with the families is that the parents and the home visiting teachers are really working as partners in the child's education. So it's like a teaching team in a classroom where you have 2 teachers who are really working together to plan activities, to set goals, and to really be involved in what's happening during that visit. So the parent is getting that parent education piece. Our home visiting teachers are also really focusing on trauma and social emotional development. And with that, using conscious discipline, which is a trauma-informed social emotional program. And so parents are now able to identify brain states, right? Because when they understand what brain state their child is in or which brain state they're in, they're able to upgrade or to upshift to be able to access their prefrontal lobe so that they can do problem solving just on a day-to-day basis. So these are things that typically teachers would be teaching and modeling in the classroom, but now parents are working with home visitors, teachers to help really strengthen that within their family relationship. Our home visiting program uses an evidence-based curriculum, Growing Great Kids, which also focuses on character building and brain building, which helps to build the cognitive part of the brain, bodybuilders, so getting kids physically up and moving and getting families and parents and siblings up and moving. And so we have seen such, and that's just more of an of a closer look at what that looks like on a day-to-day basis with our families. Our partnership with Help Me Grow has helped us to be able to serve more families, which we know is needed. Our home visiting program is always at capacity. And so to have that partnership has been extremely helpful because it's allowed us to extend those services to other families within the community. We are right at the beginning of our planning. So we're doing a lot of training. We're doing a lot of curriculum training and social emotional training and cultural competency training to get those staff in place to take on those additional families. So I'll be excited to see where we are 6 months from now. But I know that with the work that we're doing, in addition to having this partnership, it's just going to really help this to expand for our families that we serve and for our community.
Thanks so much, Rosalyn. I feel every time I hear about home visiting and the experience families are having, I learn a little bit more about the power of the intervention. And congratulations that you're a newer Help Me Grow provider. And that's really a testament and evidence of the growth that has been led at the state level by Director Corney and Governor DeWine and the Department of Health to expand access and triple the number of families served in evidence-based home visiting. So we'll be thrilled to check back in on your progress another year from now. Commissioner Rice, I'm going to turn to you. Some of the questions and comments are coming through are actually demonstrating why I wanted to ask this question, because as an elected official in Montgomery County, a local policymaker, a local leader, you are getting lots of feedback from folks in your community here and inspiring action and curiosity around your work. So how would you encourage other local policymakers, commissioners, and mayors to become an advocate for pregnant women, infants, and toddlers, both through local investments in policy and through engaging in statewide advocacy?
Well, I hope you can tell that I wholeheartedly believe that supporting pregnant women, infants, and toddlers is absolutely an investment we have to make. So it starts from there. I think it's really the authenticity of your belief in this, and then really forming relationships and having conversations. Because, you know, I have to tell you, when we do the moral and smart thing for pregnant women and children, we are also saving taxpayer dollars and using the money they've entrusted to us wisely. And these investments, no matter how large or small, are going to have tremendous benefits in the long run for all of us. You know, now I haven't mentioned, but before I was a county commissioner, I was the Montgomery County treasurer for nearly a dozen years. So I'm a finance person, okay? And I know in the arena of financial investments, it cannot be overstated the importance of the principle of compound interest. And in my mind, I think that the same principle applies here, because when it comes to making investments in our mothers, our babies, and our toddlers, you're just setting up the future. You're going to benefit in such a way, but you need to do it no matter how small, starting early, and it builds and it builds and it builds. Because honestly, our children are our future. And I'm committed to using my voice and my office to ensuring that every child, both in Montgomery County and in the state of Ohio, has the opportunity to realize their full potential, regardless of the circumstances or zip code they're born into. And I'm excited to work with other elected officials to advocate statewide. I can also tell you our local Dayton Area Chamber of Commerce did a survey recently after the pandemic, and they have identified business leaders that also are very concerned about the issues we're talking about. So that's work for me to do in the future, is to bring more people to the conversation. It's not just us that are involved in the child care in these early years, but it's the whole community. So if we have a chorus of voices, we're going to be heard far more better. So I honestly, I think it's pretty simple. When we work together, we can and we will accomplish extraordinary things. And we do have to be relentless, like you said earlier. I believe that our children just don't deserve anything less. It's up to us. And I just, honestly, I can't think of a better thing to champion. How can you not be all for children's and mother and families? How can you not be for that? Just imagine what a difference, what all of us can do. And even those who are not part of our collaboration yet, how many lives we can change in the future, what a difference we can make. So, I mean, to me, it's kind of a no-brainer. We should all be on this bandwagon, but I pledge to you that I will do everything I can to build those bridges and bring others along.
Well, thank you, Commissioner. And I know your really community of rock stars in this work. Just again, evidenced by the feedback we're getting on the webinar, they will be in touch, and you will be helping us and other local policymakers really lead the way in our state. So now to Director Cornian, and this is our last question. So as you implement Governor DeWine's vision for Ohio's youngest children and plan and look ahead for the state budget deliberations in 2021, two questions. What do you, because it's never just one, you've got to have two. What do you want us, the Ready, Set, Soar Ohio Coalition, to know? And how would you invite us to engage in our shared work moving forward?
So first and foremost, I think the governor has been clear that his priority focus is children and families. Literally minutes after being sworn in, he signed an executive order 2019-02D. So the second executive order he ever signed created the children's agenda. So I think that just speaks volumes to his lifelong commitment and his commitment going forward to kids and families. So certainly it will be my priority focus to ensure that children and families and programs that support our vulnerable children and families will be well represented in our budget. But I think it's obvious that COVID has had a significant impact on the state economy. So there will probably be some very tough conversations that we all have to have. That being said, I think the governor also says that he makes his best decisions when he hears from the experts and when they give us advice and feedback and thoughts. So we want to hear from you. We want to hear how our program's working. I loved hearing from Rosalind for the first time that she's a brand new Help Me Grow provider, and that's been able to expand their footprint of the number of families served. So reach out to us. Tell us what's working, what needs tweaked, what policy changes are needed, because we want to hear from you. And that's the best way that we can possibly make policy at the state level. So reach out, share through Shannon, share through Linnea, or reach out directly to me and my team. Our door is always open. But also I think we need to clone Commissioner Rice, and we need to have her come up to Columbus much more often to share her passion around kids and families, not just with the executive branch, but also with our friends in the General Assembly. So that would be my ask. Please let us know what you think we need to be doing better to better serve kids and families. So thank you.
Thanks so much, Director Cornian. And you already know that we're definitely going to, to do that for you. And I agree. Commissioner Rice is such a fantastic advocate and leader. And we are really in the business, and our coalition is in the business of building champions and supporting them in local communities. So we are really hoping that there are more local policymakers, more business leaders, more providers and families that can really center the needs of families in our next state budget process, which we'll all get through together, but we really hope our voices are the loudest, and we're going to do our darndest to make sure of it. So thank you so much to all our panelists. Again, I just think the public service and the work that you all put forth for the state, for our communities, is just really incredible, not just in the last 7 months, but really dedicated your careers. And so thank you. So now it's my job to somehow, after that incredible panel, give you all our call to action. And I think that Commissioner Rice said it best when she said it's a no-brainer. So I'm going to just simply ask you again to join us. Together, we can make Ohio the best place to be a young child. So to our state and local policymakers that joined us, we seek to be a resource to you. We want to problem solve with you and support the prenatal and 3 policies and investments you explore and the legacy you leave. We're always seeking prenatal 3 champions, and we can easily connect you with your constituents who are leading the work in your community. We thank you for engaging with us today and in the future. If you are currently a coalition member, thank you. We need you now more than ever. I know we've been working so closely with so many of you during this time, but we want to dig deeper. We want to elevate the work of the coalition and the work of your organization. While we have about 100 coalition members, there are so many of you here with us today. So for those who haven't yet joined our coalition, please do so by reaching out to us directly or visiting ReadySetSoarOh.org. I can assure you that if you joined us today, there is a place for you at our table, and we need you. Let's work together to identify where we have shared policy priorities or our missions and visions intersect. So please visit our website as a resource. We've added more resources, we have county fact sheets for every county in the state of Ohio to give you a snapshot of what it means to be a pregnant woman, an infant, a toddler in your community. We have statewide fact sheets that are looking across systems about really what is the state of our babies in the state of Ohio. So please, again, use our resources and continue this conversation today with us. As you join us, please know we bring an incredible staff and an army of leaders and experts at the local, state, and national level. And we thank all of you, our funders that support us. And I think specifically the groundwork staff today and for supporting this important work and this event here today. So once again, thank you for joining us, and let's talk soon. Have a good day.